very good evening. From stories around the world to stories here at home, this is the National News Broadcast. I'm Vidushni Sadis Kumar.
Good evening, I'm Lakshita Dirasingha, and to start off, we take a quick look at the top stories for tonight. Quarantine curfew extended by another 1 week. Economic centers will be open tomorrow and day after. Another 2 million Sinopharm vaccine doses will be brought to the country tomorrow. Afghanistan is facing the risk of the spread of the coronavirus. A kilogram of sugar will be given for 130 rupees through Satasa. Colombo Stock Exchange registered a record performance. Constructions of walking path on the bank of Parakrama Samudra suspended. Turkey is to take over Kabul airport.
In your local stories this evening, President Gotabaya Rajapaksa has decided to extend the quarantine curfew until 4 a.m. on the 6th September. The decision has been taken during a special COVID Control Committee meeting at the Presidential Secretariat this morning. Progress of the vaccination program was reviewed at length at the meeting. The President instructed health authorities to inform medical officers and to apply if there are persons who are above 30 years who have not received a vaccine or areas that have not received vaccines. It was disclosed that opportunity has been given for persons who have not received the first dose of the vaccine to get it at a place where the second dose of the vaccine is given. Prime Minister Mahinda Rajapaksa pointed out that the regional politicians should encourage the people to get the vaccine. The President said that attention should be paid by the doctors and health authorities who have recommended measures to be taken to control the virus on the best measures to be taken in future as well. Persons who are above 60 years and individuals suffering from non-communicable diseases should be hospitalized as soon as possible if they get infected with the virus. President Gotabaya Rajapaksa pointed out that there are reports of persons leaving hospitals soon following proper medical treatment. The decision to cremate a body of a person who is not being infected with COVID and a person not under home quarantine within 24 hours will continue to be applicable. Army Commander General Shavendra Silva said that the program to medically supervise patients under treatment at homes is successfully implemented. The President emphasized the need to pay a special attention on the persons engaged in daily work and low-income recipients during the time of quarantine curfew.
දෙකක් තියෙනවා. එකක් තමයි variants කියන එක හැදෙන්නේ. ඒ කියන්නේ ප්‍රභේද කියන එක හැදෙන්නේ virus load එකක් community එකේ තියෙනකොට. එතකොට booster එක දෙන එක දෙන්න වෙන්නේ immunity level බහිනවා නම්. එතකොට ඒවයි data බැලුවාම සාමාන්‍යයෙන් මාස 5ක් 6ක් යනකොට අඩු වෙන්න පටන් ගන්නවා. high risk groups වලටයි වැඩිපුර expose වෙන අයටයි තමයි ඒ රටවල් පවා boosters දෙන්න කියන්නේ. නමුත් WHO එක ගිය සතියේත් ඇහුවාම ඒගොල්ලෝ කිසිම විදියකින් දැනට booster එක දෙන්න recommend කරලා නැහැ. first and second doses complete කරනකල් above 18. අපිට ඇත්තටම සැප්තැම්බර් මාසේ මේ මිලියන 8 ලැබුණාම අනිවාර්යයෙන්ම කිසිම ප්‍රශ්නයක් නැතුව 18 වැඩි අයට ඔක්කොම ගහන්න පුළුවන්. ඒ එක්කම අපි හොඳටම සමහර නොගහන කොටසක් මේකෙන් අතෑරුණොත් ඒකෙන් යම්කිසි කොටසක් ඇත්තටම ඒකිනුත් බූස්ටර් එකට පාවිච්චි කරන්න පුළුවන්. ඒක ගහලා ඉවරනකොට අපේ එන ෆයිසර් ටික ඔක්කොම දැන් සැප්තැම්බර් මාසේ එන්න තියෙන ෆයිසර් වලුත් මම හිතන්නේ මේ සෙකන්ඩ් ඩෝසස් ඉවර වෙනකොට ඒකත් අපිට බූස්ටර් එකට පාවිච්චි කරන්න පුළුවන්. ඔක්තෝබර් මාසේ මිලියන 4ක් අපිට ලැබෙනවා. ඒතර ඔක්තෝබර් මාසේ අනිවාර්යයෙන්ම බූස්ටර් එක ගහන්න පුළුවන්. මොකද ඒතර මාස 6 සාමාන්‍යයෙන් පහුවෙලා.
President Gotabaya Rajapaksa said that nearly 100% has been given the first dose of a vaccine. 56% has been given the second dose. 85% can be achieved by this 31st. If another 2 weeks were given and the situation remains, medical officials have to think how to realistically face this. After the second dose was completed, it was decided to give the vaccine for persons below 30 years. An analysis has to be done and it should be considered whether priority should be given to give first and second dose for those below 30 or whether it is important to give a booster for those above 60 years. Minister Bandula Gunawardena said that the sack of essential goods delivered to homes, the order is delivered within 48 hours after calling over the telephone number 1998. The vendors who visit homes do not get a good sale since people had gathered goods at homes. Minister Basil Rajapaksa pointed out the need to control the pandemic while managing the national economy. Minister Bandula Gunawardena has explained the program to provide essential food items at concessionary prices to the people at Satusa. State Minister Sisira Jayakodi said that the Ministry of Indigenous Medicine has implemented projects to provide indigenous immunity-enhancing medicines to the people covering the entire country. Minister Basil Rajapaksa said that the question is about small-scale businessmen and daily wage earners, including persons such as masons, fish stalls, vegetable stalls and three-wheelers.
අවශ්‍යතාවයක් නැහැ මොකද මිනිස්සු සෑහෙන භාණ්ඩ ප්‍රමාණයක් රැස් කරගෙන තියාගෙන ඉන්නවා දැනට. ඉතින් අර
The ongoing island-wide lockdown has been extended till 4 a.m. on the 6th of September. Curfew passes will not be required for those engaged in essential services, including apparel, industries, agricultural activities during the quarantine curfew, Army Commander General Shavendra Silva said. Army Commander said the quarantine curfew imposed on island-wide basis on the 20th of August will be effective till 4 a.m. on the 6th of September and that the current restrictions will remain in place. He said essential services, other sectors and those who report for duties are allowed to operate while pharmacies will remain open during the quarantine curfew period. The commander said the military and police are instructed to be flexible at the checkpoints when operating essential services and other sectors during the period. General Silva said the vaccination program will also continue and urged the public to avoid unnecessary travel and adhere with health instructions to prevent the further spread of COVID-19. The epidemiology unit says 6,464,296 persons have been given both doses of a vaccine under the COVID vaccination program. Meanwhile, another 2 million Sinopharm vaccine doses are expected to be brought to the country tomorrow. Chinese embassy in Sri Lanka issuing a Twitter message said 2 million Sinopharm vaccine doses are scheduled to be brought to the country tomorrow. The message said with that 7 million Sinopharm vaccine doses have been supplied to Sri Lanka in August. The number of Sinopharm vaccine doses received by Sri Lanka has increased to 18 million. Health Minister Keheliya Rambukwella says that vaccination of all citizens above 60 years will be accelerated within the next few days. A report on the persons above 60 years is scheduled to be obtained through district secretaries. Minister Keheliya Rambukwella mentioned this during a discussion this afternoon with Government Medical Officers Association. This is the first time the minister held discussions with the association after assuming office as the health minister. Under the COVID vaccination program, vaccination of persons above 60 years, senior citizens and people with special needs is being done by visiting their homes. Mobile vaccination programs were implemented today in Colombo, Kalatura, Gampa, Jaffna, Mullatiu, Trincomalee, Kilinochchi and Vaunia districts. 18,719,417 vaccine doses have been given to the people under the COVID vaccination program. The first dose of the AstraZeneca vaccine has been given to 6,577 yesterday, while 508 have been given the second dose. 29,194 have been given the first dose of the Sinopharm vaccine and the second dose to 254,794. Yesterday, 3,020 have been given the first dose of the Pfizer vaccine. The second dose has been given to 45,470. The second dose of the Moderna vaccine has been given to 49,520. Yesterday, 1,355,240 vaccine doses have been given to the people during the last 7 days. 384,091 vaccine doses have been given yesterday. The digital vaccination certificate of the Health Ministry for those who are leaving for overseas can be obtained through www.health.gov.lk website. 3,812 COVID-19 patients were detected from the country today. Meanwhile, 2,172 patients left the hospitals today following recovery. Economic centres are scheduled to be open tomorrow and day after according to health guidelines. Paliagoda Manning Wholesale Trading Complex was disinfected today.
Now on to a COVID update from the US. According to the Department of Health and Human Services of the United States, the number of coronavirus patients in the United States hospitals have reached 100,000 yesterday. the highest level in 8 months as a resurgence of COVID-19 spurred by the highly contagious Delta variant strains the nation's healthcare system.
COVID-19 hospitalizations in the United States reached an 8-month high on Thursday, surpassing 100,000 people. That number is according to the Department of Health and Human Services and isn't far from the country's all-time peak in January. A Reuters tally then showed just over 130,000 patients hospitalized with the disease. The latest stats come amid a resurgence of cases spurred by the highly contagious Delta variant. Hospitalizations have more than doubled in the past month, according to data from the Centers for Disease Control and Prevention. And that data includes a record number of children. COVID-19 admissions rose suddenly over the summer as the Delta variant became the dominant strain, and the U.S. South is at the epicenter with the country's lowest vaccination rates. Florida has the highest number of COVID-related hospitalizations, followed by Texas and California, while 95% of intensive care beds are occupied in Alabama, Florida, and Georgia. Dr. Anthony Fauci, the nation's top infectious disease expert, said earlier this week there's light at the end of the tunnel if vaccinations ramp up, adding COVID-19 could be under control by early next year. 61% of the U.S.'s population has received at least one dose of a vaccine, according to the CDC.
Back here at home, State Ministry of Home Affairs says that more than 575,000 families have been given the 2,000 rupee allowance given by the government to the persons who have lost their livelihood due to quarantine curfew. The payments are being made by district secretariats and divisional secretariats from the 23rd. 2,038,530 families have lost their livelihood due to quarantine curfew. Families who have not received the allowance will be paid the amount in next few days. Providing the 2,000 rupee allowance to the people at Vaunia South, Nedunkerni and Settikolama Divisional Secretariat areas took place today. 2,680 persons at Ratnapura Divisional Secretariat area were given the allowance today. Giving the 2,000 rupee allowance to 78,923 families in 573 Grama Seva divisions at 16 divisional secretariat areas of the Puttalam district commenced today. 8,254 families at Navalapitiya Pasbage Korale divisional secretariat area were given the 2,000 rupee allowance today. Many families at Adala Chena divisional secretariat of the Ampara district area were given the 2,000 rupee allowance today. Samurdhi Authority at Kathankudi East 167 Grama Seva division gave the 2,000 rupee allowance today. 52 families at Ulkatupata Gram Niladhari division of Polonnaru district were given the 2,000 rupee allowance yesterday. 4,950 at Kurunagala divisional secretariat area are scheduled to be given the 2,000 rupee allowance. Steps have been taken to provide the allowance by visiting the homes of the recipients.
Colombo Stock Exchange has registered a record transaction today as well. The stock exchange continuing to register a high performance this week is considered a special situation.
The benchmark all-share price index of the Colombo Stock Exchange crossed the 9,000 points today for the first time, and the market closed on 8,931.33 points. The market turnover was recorded at 16.48 billion rupees. During this week, we saw renewed interest among the retail investor participation, which contributed to healthy market turnovers. We anticipate the same level of enthusiasm and participation would continue next week as well.
State Minister Janaka Wakkumbura says that a kilogram of sugar produced by Lanka Sugar Company will be given for 130 rupees. He said that sugar stocks will be issued soon to Satosa outlets. A kilogram of sugar is sold in the market at present for 210 rupees. Paying attention in this regard, Lanka Sugar Company has decided to provide sugar at a lesser price through Satosa. When the price was increased in April, Lanka Sugar Company provided its products to the consumers through Satosa outlets. 750,000 kilograms of sugar produced by Palwatta and Sevanagala sugar factories have been given to Satosa today. Meanwhile, Minister Rohit Abe Gunawardena said that there is a stock of sugar at the Colombo harbour which has not been claimed by importers. He said that the sugar stocks will be given to the public at a lower rate through Satosa.
Irrigation Department has temporarily suspended work on the walking path that has been planned to be constructed on the bank of Parakramasamudra in Polonnaruwa due to a protest of the Mahasangha and the people in the area. Various parties accuse that the walking path will damage the bank of the tank. The Mahasangha and a group of people in the area staged a protest at the place today. Polonnaruwa District Secretary W.A. Dharmasiri and officials explained the situation to them. Thereafter, a briefing took place at Polonnaruwa District Secretariat Auditorium under the patronage of Polonnaruwa District Development Committee Chairman MP Amarakirti Atukorala. A group of people, including officials of Archaeology Department and Urban Development Authority and the representatives of farm organizations, took part in the discussion.
And that's all the stories for tonight. We'll see you tomorrow at the very same time. Until then, stay safe and good night.
Good night.